The job description of an ER tech or emergency room technician centers on providing critical support to physicians, nurses, and other emergency department staff in delivering urgent medical care. ER techs are trained healthcare professionals who work in fast-paced, high-pressure environments where immediate response is essential. Their role is a blend of clinical assistance, patient care, and logistical support, making them indispensable in the efficient functioning of emergency departments. Emergency room technicians serve as the backbone of emergency medical teams, ensuring that both the patient experience and the clinical workflow run smoothly. They perform various tasks, ranging from assisting with diagnostic procedures and wound care to transporting patients and stocking medical supplies. In a hospital's emergency department, where every second counts, the ER tech is both a skilled multitasker and a calm presence amidst chaos. The job description of an ER tech includes a wide range of responsibilities that directly influence the speed and effectiveness of emergency care delivery. As the first line of support in many urgent situations, ER techs must possess a solid foundation in medical procedures, an understanding of emergency protocols, and a willingness to act quickly and compassionately. They work with individuals in pain, distress, or even life-threatening situations, requiring a strong stomach, emotional resilience, and dedication to service. Core responsibilities of an ER tech. At the heart of the ER tech's role is direct patient care. Upon a patient's arrival in the emergency department, the ER tech may assist with the initial assessment by taking vital signs such as blood pressure, pulse, respiration rate, and temperature. They may also perform electrocardiograms, EKGs, collect blood samples, conduct glucose tests, or administer basic first aid under the supervision of licensed personnel. One of the most critical responsibilities involves preparing patients for examinations, imaging studies, or medical procedures. This includes explaining the process to patients and families, helping them onto examination tables or gurneys, and ensuring their comfort and safety. ER techs also assist with wound cleaning and dressing, splinting fractures, immobilizing injuries, and sometimes even performing CPR or using defibrillators during resuscitation efforts. In collaboration with registered nurses and emergency physicians, ER techs may help monitor patient conditions and report any changes promptly. They also document medical interventions accurately and keep electronic health records up to date, a crucial aspect in environments where timely data can impact clinical decisions. Beyond clinical tasks, ER techs are responsible for ensuring that the emergency room is well-equipped and ready for any situation. They stock supplies, clean and disinfect equipment, prepare treatment rooms between patients, and ensure that stretchers, wheelchairs, and transport devices are available and functional. Additionally, they may assist in transporting patients to other departments such as radiology, surgery, or inpatient units. Another key function of the ER tech is to maintain clear communication with patients and their families. They provide emotional support, offer reassurance, and help manage expectations while waiting for treatment. Their interpersonal skills play a vital role in reducing anxiety during what is often one of the most stressful moments in a person's life. At the midpoint of their role, the job description of an ER tech reveals a balance between technical proficiency and compassionate service. They act as the connective tissue between clinical teams and patients, helping to manage emergencies with efficiency and humanity. Essential skills and qualities of an ER tech. To thrive as an ER tech, an individual must possess a diverse skill set rooted in both clinical knowledge and soft skills. Medical competency is paramount. This includes knowing how to perform vital procedures like blood draws, EKGs, or CPR, and understanding how to follow strict safety and hygiene protocols. Familiarity with medical terminology, emergency codes, and documentation practices is also essential. Emotional resilience is perhaps one of the most crucial qualities. ER techs encounter traumatic injuries, severe illnesses, and even death. They must remain calm, composed, and professional in these scenarios while maintaining empathy and compassion. A high level of emotional intelligence helps them manage their own stress and interact sensitively with patients and families. Strong communication skills are critical. ER techs must understand and relay instructions accurately, communicate effectively with both colleagues and patients, and listen attentively to identify needs or concerns. They are often required to work under pressure while prioritizing multiple tasks simultaneously. Physical stamina and agility are also important, as the job requires standing for long hours, moving quickly, lifting patients, and handling medical equipment. Problem-solving skills and attention to detail are vital when responding to emergencies, interpreting symptoms, or following medical protocols accurately. Lastly, reliability, integrity, and teamwork round out the core personal traits. ER techs must be dependable, punctual, and trustworthy, especially in high-stakes situations. They must also collaborate seamlessly with emergency medical teams to ensure coordinated and effective care. Education, certification, and training requirements. Becoming an ER tech typically requires a high school diploma or equivalent as a minimum. However, many employers prefer or require candidates to complete a certified emergency medical technician (EMT) program, which includes coursework in anatomy, physiology, trauma care, and basic life support techniques. In many cases, ER techs are certified EMTs or paramedics who have undergone additional training in hospital-based emergency care. Certification through organizations like the National Registry of Emergency Medical Technicians (NREMT) is often required. Some states or employers may also demand CPR, basic life support, BLS, or advanced cardiovascular life support, ACLS, certifications. On-the-job training plays a significant role in preparing ER techs for the specific demands of a particular emergency department. New hires often shadow experienced staff to learn procedures, protocols, and documentation practices unique to their facility. Opportunities for advancement are also available. With additional education and experience, ER techs may become licensed paramedics, registered nurses, or healthcare administrators. Some may also pursue roles in emergency medical services, disaster response, or patient advocacy, work environment, and daily challenges. ER techs work in dynamic, fast-paced settings where no 2 days are the same. Their shifts may include nights, weekends, or holidays, depending on the 24/7 operation of emergency departments. The environment can be physically demanding, emotionally intense, and occasionally hazardous due to exposure to infectious diseases or violent patients. Despite these challenges, many ER techs find the work deeply rewarding. They are instrumental in saving lives, providing critical comfort, and making the healthcare system more efficient. The adrenaline rush of emergency medicine, the camaraderie among healthcare workers, and the direct impact on patient outcomes make this a fulfilling role for those drawn to action and service. Some common challenges include dealing with uncooperative or aggressive patients, managing multiple emergencies simultaneously, and coping with emotionally distressing cases such as child injuries or critical trauma. ER techs must learn to process these experiences healthily, using support networks, debriefing sessions, or professional counseling when needed. Conclusion. The job description of an ER tech encapsulates a career that demands quick thinking, compassion, and unwavering dedication. Positioned on the front lines of emergency medicine, ER techs provide vital support that ensures patients receive timely, safe, and effective care during medical crises. They embody a unique blend of technical expertise, emotional intelligence, and physical stamina, making them irreplaceable members of emergency care teams. Whether assisting with life-saving procedures or offering reassurance to worried families, their role makes a tangible difference every single day. For individuals who thrive under pressure, have a passion for healthcare, and wish to be part of a high-impact, team-driven environment, the role of ER tech offers both challenge and opportunity. As healthcare systems continue to evolve and expand, ER techs remain a critical component in delivering rapid, compassionate, and competent emergency care.